Minister, the census again confirmed, as we expected, our ageing population. No surprise on it. And the need, there's a great need always for people who are growing older to be able to remain independent for as long as possible and to live in their own homes and with dignity. And day centres are a fundamental part and a key support in providing that, providing social interaction, advice, providing support to both the client and also to their carer. Minister, unfortunately there's a big gap in services around the Macroom area. Up the Lee Valley, parishes such as Macroom, Kilmurray, Kilmichael, Ivlera, Ehina, Clondrohad, Ahabolog, even west of the town as well, in Ballyvourne and Killamarcha. There is a gap. Minister, dementia services as well. Over 55,000 people with various conditions, dementia conditions, and ASI are supporting with so many families and their carers. In Macroom, we have an ambitious plan to get dementia-friendly town identity and an enthusiastic group driving that forward. It's so that people have the chance to live their best lives for as long as possible. There is a smaller daycare service, a small scale, on Wednesday being provided by ASI, and there's a real opportunity to grow that if they had the most suitable facilities available to them. And on the hospital grounds in Macroom, there's a very new building. It's no more than 20 years old. It was vacated when the primary care centre was being relocated down to the Mart area. Minister, you had the opportunity to see it yourself. I know you're well impressed with the facilities that are there. You would have had the opportunity also to see that while there was work being done on the nearby hospital, the community hospital, and that's at a very advanced stage now, some services were relocated into, like the ambulance, into the building, and there's still a considerable amount of space available to deliver services in that building. It would be a great location to be able to deliver day services, dementia services, even now, if that opportunity was available. For over 10 years, HSE have been talking about and making different preparations about plans for providing day services around the Macroom area. And in the meantime, the demand and the need continues to grow. HSE shouldn't need to wait until the nearby hospital job extension is completed, that there should be as many efforts as possible to run in parallel to advance those services. And I understand that some preparations have already been underway and plans being advanced, but that they're still not moved on to tender stage. Of course, also in the meantime, ASI and their day services being run on Wednesdays, it would be, if they could be facilitated in that building, it would also provide an opportunity to grow those services locally. What I'm very conscious of is to provide services for older people in their community locally, and also to support the services.
I want to thank you for raising this issue and your constant advocacy. It's not the first time we've spoken about dementia-specific supports in the Macroom area. It is a key priority for the government to allow more people to engage in services that allow them to remain independent and live in their own homes with dignity and independence for as long as possible. And as you are aware, the HSE has operational responsibility for planning, managing and delivering health and personal social services. A wide range of core services are provided for older people, including home support, daycare, community supports in partnership with voluntary groups and intermediate care, as well as long-stay residential care when remaining at home is no longer longer feasible. But Deputy, as you know, when you alluded to it there, we have an ageing population. We also have the highest life expectancy in the EU, as deemed by the World Health Organization, and people want to live at home for as long as possible with the correct wraparound support. So I call it the triangle of supports: home care, daycare and Meals on Wheels. Hugely important to support people to age in place. Access to day centres can make an important contribution by providing invaluable support, advice and social interaction for older people who may, for any number of reasons, be experiencing isolation and loneliness. And we know for a fact that older people have found it hard to reconnect since COVID. They're finding it hard to take that confident step to come back into the community. Older people, they also benefit from increased physical activity, cognitive stimulation, enhanced nutrition, healthcare monitoring and social work support. Day centres are also an important indirect resource for carers. Day centres provide a range of services for older people, as you know, but I suppose many HSE day centres offer a higher dependency day for day supports for people living with dementia who need more one-to-one support, including nursing support, and the development of this specialist day centre is based on local population need. 30 people a day are diagnosed with dementia, and Deputy, the figures we have currently are 64,000 people are living with dementia. So having dementia-specific supports in areas is hugely important. I have a very good working relationship with the Alzheimer's Society of Ireland. During COVID, the opportunity was taken to do a risk assessment of each service in the country and our day services as well, to make sure they were fit for purpose from infection prevention and control measures. And I announced an additional €3.5 million to support up to 330 daycare centres throughout the country. And also I secured an additional €2.1 million for dementia-specific community daycare services. And as I've said, we've 46 now up and running in partnership with the Alzheimer's Society. But to your specific point, I visited Macroom, the campus where the community hospital is. I've seen the works that are underway and that some are completed. A fantastic facility. But on the campus, there's room to do so much more. And immediately across was that former building that I was in, a former health centre. At that particular time, the ambulance services were using it. My understanding is they no longer are, or maybe they're using part of it. But I do believe there's a huge opportunity here, because when we're trying to put supports in place for people, we have to think outside the box, and we have to utilise every empty building that's there, make it fit for purpose. And I believe this is the plan. The HSE has advised me that it's not possible to define a timeline for the daycare centre project at this time, as allocation of capital funding is still currently awaited. However, they are very supportful of it, and it's something that I'm going to take a specific interest in myself, because, you know, I often, since I've come into this Dáil as Minister 3 years ago, I often speak about the postcode lottery and how important it is, regardless of where you're living, that you can access those vital supports.
Thank you, Minister, and I want to acknowledge the huge effort and huge work that you have been delivering for dementia services across the country. Through that support, we've been able to get, as you said, the Wednesday service up and running in Macroom. It could be so much more if it had that opportunity available to it, and it's for being able to support families and clients right across that large area of Macroom and the Lee Valley. The building currently works are very advanced on Macroom's new community hospital extension. They should be finishing up there possibly towards the end of the year, possibly into the start of next year. And really, you know, it's time to be moving forward with the plans for the other building. Even that there is plenty of space in there at the moment, even in some months' time, you know, that excuse that HSE have been putting forward, and yes, you have to acknowledge it's an excuse, we want them to move on, that won't be there for long more. So we really need to make sure that there's capital funding available and that the project can move along and put in place that service. Minister, have the HSE come looking for capital funding for that? Is it part of the forthcoming capital programme? And if they have asked, how has that request been received? It's vital that it would be put in place in the next immediate capital programme so that works can advance without further delay on it. In the meantime, it would be a great opportunity to grow the support or to grow the service that ASI have been providing on the Wednesdays if they had access on that building, and it would all serve to benefit older people and their families across the Lee Valley and Macroom area.
Thank you, Deputy, and thank you for the way you articulated how important this service would be. It's fantastic that there is a Wednesday service, but I don't believe that where the service is the most appropriate setting that it could be, because especially for people with dementia, it is really, really important that they have the stability of a centre that can provide the supports for them and they can go back to it week on week. And for a lot of people, they need more than one day support. It's great to have the one day in place, it's a start. And, so we know that service is there. And day support for people with dementia it's an invaluable source of respite for the carer, that they have that few hours during that particular day for the support. As I said, the HSE have advised it's not possible to define a timeline for the daycare centre project at this time, as allocation of capital funding is still currently awaited. And then the HSE could then progress to the tender phase, and once that phase had been completed, timelines will be able to be set out. So look, I'll have to check exactly whether an application has come in. I can revert back to you on it. Now is the time for the application to come in, because we will be devising the capital plan for 2024. A lot of work will happen now in the next 6 months in relation to that. I'm very supportful of of providing this service in that particular area. And I do believe that working with the Alzheimer's Society, this can be delivered. There's great cooperation between the Alzheimer's Society and the HSE and myself as Minister. As I said, 46 services up and running all over the country now. We still need to do more. Everybody acknowledges that. But I will take a specific interest in this, Deputy, and I will check it out in relation to whether that request for capital funding has come in. Now is the time to do it. And I do believe, the day I was in the community nursing unit there, that beautiful new extension was well underway, and it will be, that whole campus can offer so much for the people of Macroom and the surrounding areas.